The aims and objectives of the charity is to raise awareness of the condition, to support those with it in many different ways, and to educate the wider public on the different aspects of diabetes. For the conference, which is being held on the 15th of June at the Radisson Hotel, we have 4 eminent speakers coming over from the UK, talking on different aspects of diabetes, including having the condition whilst aging, new technologies, the use of technology in the treatment of diabetes and the support of those, particularly those with type 1 diabetes, has really taken off in recent years. We have, for a period of time, been supporting children with funding the use of technology, which is now funded by government. But that's moving. The types of technology are improving at enormous speed. So we have an eminent speaker on the future of technology in the treatments and support of diabetes. We have an important aspect which really hadn't been dealt with in the past. 2-3 years ago, we were able to secure some funding from within government to support those who had psychological or psychiatric issues. Whilst that funding is in place, like so many other jurisdictions and other posts locally within the health service, it's been very difficult to recruit somebody to that position. So we have somebody coming over to speak on the link between diabetes and psychiatric and psychological issues. So that's just another speaker. Our patron, Dr. Karen Kidd, will give us a short presentation in the afternoon because she is a GP in her own right. So it looks as though it's going to be quite an informative and eventful day. Other than that, during the week, there'll be an offering of free testing at specified pharmacies throughout the week, and we will be raising awareness during that time as well.
That's great. Do you foresee any challenges for the charity going forward?
It's always a challenge. I think what is very important for us as a charity to be aware and keep abreast of the various changes that are. We're very fortunate. We have a very good relationship with the health professionals at the Diabetes Centre, where we assist one another. But it's very important we keep ourselves informed of the different changes. We act as the voice of patient and represent their needs, and where necessary we will take the issues that are raised forward and have discussions with either government members or other people with a particular interest in the issue that needs resolution.
So if somebody had a diabetic diagnosis, would you ask them just to contact you and get involved with the charity?
What occurs is that a formal notification is sent by the GP to the diabetes service so that they can be registered within the service for formal support. And in the initial stages, for somebody with either type 1 or type 2, they would receive a podiatry check, retinal screening examination, and thereafter and some specific education. And it's different types of education depending if you're type 1 or type 2. And thereafter they are placed on a register for regular examinations to make sure there's no deterioration, for example, in eyesight. Something that might adversely affect the retina would be fairly typical as part of those. They also receive an education package, and again that differs between type 1 and type 2 patients, at which point as well they also receive an information pack from the charity. So everybody who is diagnosed and referred to the Diabetes Centre will receive at that fairly early stage just an information pack. One has to be very careful because for some individuals to have this diagnosis, you have to be cognizant of their needs and not overloading them with charity information at too early a stage.